Orlando Theory of Deliberate Nursing Process. Introduction. Her name is Ida John Orlando. She born in 1926. 1947, she started her nursing career as a diploma nurse at New York City. 1951, she has done her BSc at the Johns University at New York City. She became famous because of her publication. She has published in 1961 the major publication, that is the Dynamic Nurse-Patient Relationship and Function Process and Principles. And 2007 she died. Main concept of her theory is that talking about the dynamic nurse-patient's relationship. Her concept is the dynamic nurse-patient relationship is based on the three things, that is patient behavior, nurse reaction and nurse activity. So the nursing process should be unique because she is telling that every individuals are unique. The nursing process should meet the patient's need. It should improve the patient's behavior at end result. And also she is talking about the good patient's behavior. How the patient's behavior. She is telling that the patient who are the cognitive or the physical impaired person who is not able to express their thoughts, views, needs and ideas. So his behavior may be verbal and some patients will be non-verbally, they will not ventilate verbally. That's her this one. So the nurse reaction, the nurse is the one who has to understand. It consists of perception, thoughts and the feeling. For example, she is telling that if the nurse walking in the corridor, suddenly she see the patient sitting in her room with keeping the hand in the abdomen and with a very pathetic face, immediately, deliberately she has to enter into the room, ask, how are you? What happened? Why you are sad? May I help you? She is thinking that the perception, thought and the feeling at a simultaneously it has to work. We will see clearly in this class. Nursing actions is clearly saying about the nursing action should be interpret the patient's behavior. It can be how it can be it may be your behavior, nurse action. I mean, it's like the nurse will interpret the patient's behavior and the nurse behavior should be automatic and initiative and interactive and deliberate. It should be instinctive behavior. Immediately it should has to come. Orlando is talking about the nurse patient action and the nurse reaction and the nurse's action. So the patient behavior, she is telling that it's like a helpless behavior. That's what she told. It's a cognitive and physical impairment they have. Sometimes they ventilate, sometimes they may not ventilate it. So you can understand, you can perceive their verbal and non-verbal communication. She is telling about what is verbal. Verbal is complaining about the demand, about refusal. They will tell negative activity. They will not cooperate with you. They will argue with you. This is all you have to take into that consideration. And non-verbal may be the physiological changes. Suddenly there will be edema, swelling, maybe the swelling of the eye. You can see that one. So how you have to interpret? So your this one should be the dynamic interpersonal relationship. Your communication should be the nurse reaction. So your reactions is the explore the patient's behavior. It should be perception, thought and feeling. In this perception and thought feeling simultaneously and deliberately, immediately action you have to take, how to help him immediately. So how it is the nursing action? When the person is like this condition, the nurse should perceive and thought, immediately feel and immediate nursing action. She has to behave deliberately, automatically and immediately. Can I help you? What is your need? What can I do? So what help you have to? She has to either the positively reinforce or you have to provide explanation, give psychological support or explain the procedure, what you have done, or you have to reassure immediately. So that's what she is telling. Nursing action should be automatic and immediate and simultaneously. So it should meet the needs of the patients. So she's not telling this need, that need, basic need, or the needs are unique and individuals are unique. You have to meet. But this, once the patient's needs met immediately, there will be a improvement in the patient's behavior. You could see in their patient's behavior either in a verbal or the non-verbal form you could able to see. So she is clearly explaining about this, her concept. It is a dynamic interpersonal relationship. The relationship should be patient's behavior and the nurse's reaction and immediate nurse's action. It should be automatic, deliberate and interactive and immediate instinctive action, and it should be communication process and the behavior. The thing is, this theory can be applied anywhere, but she is not much focused. This is the only small limitation. The Orlando does not spoke about the unconscious patients, because unconscious patient you cannot expect either the verbal or the non-verbal communication. And what is called the meta paradigm? She is talking about the meta paradigm is a person. Person is viewed as a human being who exhibits the verbal or non-verbal behavior. Her individual needs or whatever abilities, everything deals with the situation, anything. So, environment is not specifically defined by the Orlando. It is impaired by the nursing situation. What's occurring in these circumstances with the nurse and the patients is the environment. Health is not specifically defined by the Orlando. It sends a comfort, the feeling of adequacy, feeling of well-being, freedom for mental and physical comfort. So you have to make, this is what she is telling, a health. It will reflect in the patient's behavior and thought process. Nursing is it's like a distinct profession that function autonomously and potential need for the help the patient's immediate situation. Nursing process also should focus on the nurse patient interactions is giving very much importance. Like immediately you have to ask, you have to understand about the verbal and non-verbal communication. You have to interact, you have to open and interact, explain the procedure and give positive reinforcements and attempt immediately to relieve the mental and physical discomfort. So she is telling the perceive and immediate and automatic. That's what she is telling about perception and thought feeling should be in a simultaneously for the patients, and improve the behavior of self-care abilities. If the patient is so good, you have to encourage and motivate them to do that. Tries to enhance the patient's sense of well-being. So the views the patients as a holistic human being. Holistically you have to view. And it nursing care, it involves the continuous exchange of the information and actions it triggers by patient's behavior lead to the nurse reaction. Then new action back to the patient's behavior. That's what she's telling. So what she's telling, it is always interact with the patient's behavior. It nurse action, it belongs with the patient's behavior. The patient's behavior will be nurse reaction. Nurse reaction will be motivate this behavior, will perceive and will make the nurse to act according to that. Again she will see the patient's behavior, either reinforcement or realign it, and until the nursing care should be until the improvement of the patient's behavior. How the patient's feeling is, the well-being is good or not. That's what she is talking about this theory. So this is the Orlando's deliberate nursing process. You have to the key concept is patient behavior, nurse reaction and nursing activity. Patient behavior, verbal or non-verbal. Nurse reaction will be perception, thought and feeling. And nurse activity will be automatic, deliberative, interactive and immediate to help them. The end result should be make the patients feel comfortable and it should reflect in their behavior. The positive behavior must be seen. That is the effectiveness of nursing care, what you are giving. If not there, again you have to do the nursing actions like the positive reinforcement and positive exploration or explanation, and give psychological support and encourage the independent decision making if they are very good, and reassure them so that the patient's behavior will be, sense of well-being will be felt by the person. Thank you.